The Ghana Health Service has expressed concerns over the rising cases of blindness across the country, describing the situation as alarming. According to the service, about 165,000 Ghanaians have already gone blind due to cataract, making it the leading cause of blindness nationwide. Glaucoma and diabetic-related eye diseases are also significantly contributing to blindness in Ghana, according to accounting for nearly all cases of visual loss in the country. The alarming situation was revealed by head of the National Eye Care Unit at the Ghana Health Service, Dr. Honameto Afeke, as part of activities marking World Sight Day. And she joins us via phone to get more understanding about whether or not you watching me today is probably blind or not. Dr. Afeke, thank you for joining us this afternoon. How serious is the current blindness situation in Ghana?
Thank you, and good afternoon to charity listeners. Yes, so currently the blindness prevalence in the country is about 0.74%. That translates to over 250,000 Ghanaians who are blind. And out of this, about half of them is as a result of cataract, which is an opacity of the light in the eye. And the rest of the causes are the glaucoma, which is almost 20%. And then we have posterior segment disease, which includes diabetic retinopathy, which also accounts for almost 13% of the total blindness. And then we have cornea disease, which also accounts for about 11.2%. And for the corneal opacity, what we need is the legislation on the organ and tissue donation and transplantation. For these patients who need corneal transplant. So this is what I can say for now.
Well, Dr. Afeke, tell me, for cataract alone, would you say that it has been one of the leading causes over the years, or you're seeing quite a surge or an increase this year particularly?
No, I think globally it's one of the leading causes in the low and middle income countries. So it's always been the number one cause, basically because the major risk factor is aging. So those above 50 years who are likely to develop cataract. So it's a global issue, and Ghana, it's also the number one cause of blindness. And currently we have over 160,000 people who are, have the condition.
I heard you earlier try to break the data down, but glaucoma and diabetes-related eye diseases, how much do they play in this blindness burden for us as a country? How much role do they play?
Yes, so the number one cause I said is cataract, and the second leading cause of blindness in this country is glaucoma. It's glaucoma. That's the second leading cause of blindness. So we have, it's about 19.4% of the total blind. So 94% of 20% of the 250,000 people. So we have almost 60,000 people who are blind as a result of glaucoma. And glaucoma, I need to stress that unlike cataract, the solution is we have a solution which is surgery, perform surgery, and vision is restored. But glaucoma, it's the number one cause of irreversible blindness. Irreversible blindness. So when you go blind as a result of glaucoma, there's nothing we can do. That is why we, creating the awareness for people to, go to visit the eye facilities for screening, especially if you have a family history of glaucoma. It's very important that you are diagnosed early and then treatment is started. Usually has to do with pressure on the eye. So either use the drops or a surgery is performed to reduce the pressure on the eye so that you don't go blind. So we need to ensure that people have an understanding that glaucoma is quite a very serious condition.
Well, Doc, at least it's the second. Back to the first one, which I've just said that is quite treatable, and maybe before I let you go, why is it still prevalent if at least it's largely treatable? Why aren't people coming to the facilities?
Yes, so there are barriers to the uptake of surgery. One is the lack of access. We have because it's surgery, so it has to be performed by ophthalmologists, the surgeon. And unfortunately, some of the regions we don't have the ophthalmologists there, even though we are making effort to train more of our surgeons so that they can be posted there. But currently, we have quite a number of them, especially the newly created regions where we don't have ophthalmologists. And another barrier is the distance, and then we have issue with a lack of awareness. Some of the people are not don't know that their condition can be treated, and they attribute it to all kinds of causes. So that is why we are also creating the awareness that that people should know that if you have cataract, you can be treated. And at our national level, we have a national cataract outreach program. Where we provide outreach services, surgical outreach services, to the deprived or underserved districts. So we send a team of surgeons and nurses to go there and then perform. Usually it's a 1 week period. They go there to perform surgery, the cataract surgery, for those who cannot travel to the big cities, and they receive it. But that is not enough. We still have a lot of areas to be covered, and financing is also another issue challenge.
Right.
We need to get our facilities well equipped with them operating microscopes, so that when we post the surgeons there, they can perform the surgery.
Quite understandable. Dr. Feke, thank you so much for joining us on the news today. He is with the